Dr. Seetharamu. What are the barriers to implementing patient-centered care in the management of small cell lung cancer? And what are we learning from the existing evidence?
Yeah, thank you. It's a great question. I would start by saying that I think the first thing is really limited treatment advances compared to other types of cancers and clinical trial access. So compared to other types of cancers, including non-small cell lung cancer, we have very, fewer options. Patients, despite all the advances, the outcomes are still, suboptimal. Many of our patients present with very advanced disease and have multiple other comorbid conditions. So it makes it difficult to deliver optimal care or to enroll patients in clinical trials. In addition, we do know that palliative care improves outcomes in non-small cell lung cancer. We do not have this data as much in small cell, and there is a stigma around it. People do not avail palliative care options, which are perhaps most appropriate for patients with small cell lung cancer. Lastly, I think there's also streamlining the processes. We do have the low dose CT scan, lung cancer screening. Fewer patients avail it. With increased availability, increased acceptance, and increased uptake, probably we can see more small cell lung cancer cases in early stages that will ensure cure. Also, there's many of our patients with small cell lung cancer have, lapses in supportive, social support. And that's something that we're working with. There's also quite a bit of disparity when we talk about small cell lung cancer, and that's been extensively published. So delays from screening to diagnosis to treatment.
Thank you so much, Dr. Seetharamu. So given those barriers that you just outlined for us, how can healthcare providers overcome those practice barriers to actually enhance care for patients facing small cell lung cancer?
So I think I have a few ideas, a few suggestions. I think, first and foremost, make sure that the screening program is well adapted. We still see less than 10% of patients being screened, so that is something important. Hand in hand with that is tobacco cessation. So decreasing the incidence, early detection is number one and number two for sure. In addition to that, once patients are diagnosed and are presenting, improving or having streamlined processes for diagnosis from the patients enter care to the time they start treatment, reducing the time to treatment is extremely important. We're really kind of, sitting on a time machine here, really trying to get things done in a very quick order. So streamlining the processes, whether the patient is in the hospital or presents as an outpatient. Lastly, making sure that clinical trials, or if they're available, making sure that patients are screened for it, making clinical trials available to patients, making criteria broader so that patients can be enrolled. And then ensuring that everyone within a particular health system or network is aware of recent advances and patients get optimal care wherever they are located throughout the country.
Thank you very much. I'm going to turn to you, Ms. Sandy. As a nurse practitioner in this space, what is your perspective regarding the primary barriers to accessing effective patient-centered care for small cell lung cancer? And then similarly, what are some strategies that you believe can be implemented to overcome these barriers?
Thanks, Dr. Rochester. I think Dr. Seetharamu covered a lot of the barriers, really, is getting patients to treatment quickly. As we know, this disease is very aggressive. So, this is not a disease where a patient might say, well, I have a 2-week trip to Europe planned. I'd like to go there and then start treatment. I actually, in non-small cell lung cancer, maybe, but in small cell lung cancer, it's so important to get them started very quickly on treatment because of the aggressive nature of the disease. And it is a very chemosensitive disease, so they may feel better very quickly. One of the things that we do in our practice is if we see that a patient is coming in who's newly diagnosed with small cell lung cancer, whether it be extensive or limited stage, many times our nurse navigator is looking at this in advance, and we're pre-starting the chemotherapy before they even get there. Because many of these regimens are a 3-day regimen. So we want to make sure that our next 3 days available for infusion, that we get this patient started right away. So sort of looking ahead can be really helpful, especially if the patient's coming on a Thursday or Friday. We're not open generally on the weekends to give chemo, so we'll make sure that we get them scheduled that following week. Again, getting these patients to treatment very quickly can help them feel better quickly.